All right. So again, I like to start with O, then the I, the A. The pec major has a giant origin. It kind of starts off, with a broad area, and then has different fibers kind of come down together in a smaller insertion. So whenever you have a muscle that kind of starts at a big area, it's kind of indicative that it can move on something on different angles, right? Because you're able to cross on different angles with it. But let's take a look at the details. It originates on the medial half of the clavicle, the sternum, and the cartilage of the first through sixth ribs. And again, on the muscle, or excuse me, the diagram, which is the bone on trail guide, it's nice because it shows you exactly where. So it's kind of like that. And you can palpate on yourself. Your sternum is, that hard bone right in the middle. And then if you palpate right to the sides of it, you can feel kind of like where the drop off is on the ledge. And you can especially feel the drop off if you kind of go up and down a little, right? Because ribs come out of there. So if you happen to be landing on a rib, you're not going to feel the same drop off. So then move up and down a little bit and you'll feel the drop off from sternum to ribs. The sternum has three parts really, and they all have different names. So sometimes you'll hear that distinguished, but this book is just calling it the sternum. Questions so far? All right, cool. So the insertion is the crest of the greater tubercle of the humerus. And so we know the greater tubercle, right, from our rotator cuffs. And the crest is just the area just distal to it. So the the greater tubercle, is the bigger bump. And then moving down below it is the crest of the tubercle. Now, most of the pecs, they're superficial, and most of them are very palpable on any size human. You're going to be able to feel their pecs. I personally tend to mostly work with the muscle belly of the pecs as well as the origin, but I don't work with the insertion as much. That's just me. We have two other experts in the room. Jill and Elizabeth, do you like to work with the insertion of pecs?
I really don't. I really do more in the origin and the belly itself. And I do a lot of cupping those areas.
Yummy.
I do a lot of insertion work.
Tell us about that, please.
Well, mostly because I've had, so many car accident cases where it's exacerbating and already like head forward, shoulder forward posture. So I just want to, open all of that up as best I can. And just, it's such a big muscle. And such a strong puller too, that,
Thank you.
Be out.
Nice. This week, Thursday, we're going to do some massage with the pecs, and there's some good videos in the module to check out. Just a little preview, just a little highlight. Obviously we have to be careful with breast tissue, right? And that depends how large breasted someone is, how far inferiorly we can get, right? Some folks, we have to stay up really close to the clavicles, and other folks we can get further down. But in any case, there's always some parts of the pecs we can work with client's consent, of course. It's one of those areas you want to be especially careful, right, to get client consent. But some of the areas that are especially nice to work is that we get trigger points all along the edge there where the muscles attach to the origin. We also get trigger points along this edge here is called the free border. And so that's basically the inferior lateral. And if you take your hand, right, and just slide out laterally from your sternum, you will feel the muscle belly of the pecs, right? So grasping on that lateral border is what's called the free border. And so you can do a lot of work. We'll do this in lab where you can really, kind of grasp that tissue and really massage it. You will hopefully notice already, I will to highlight the color here, that we have upper and lower fibers here. So it's kind of almost like two muscles of the upper fibers where they start from the medial border of the scapula, and then the lower fibers down from the sternum. So our different angles, but the whole length of bellies also really excellent to work as far as you can without getting into the breast tissue. So let's take a look at pec major's actions. So pec major adducts the shoulder glenohumeral joint, medially rotates the shoulder. So again, turning in like this. Assist to elevate the thorax during inhalation. And then the upper fibers, so those ones that originate at the clavicle, flex the glenohumeral joint and horizontally adduct the shoulder joint. Now, flexion might be hard to picture, but if you imagine that you're already starting in an extended position, then you can see how clearly it could pull forward like that. And then the lower fibers can extend the shoulder, which again can seem confusing starting just straight. But if you start forward, you can hopefully see how that angle could pull them back. Yeah, James.
I kind of noticed it's similarly shaped or like attached, like its insertion organs, and even its actions are very similar to the movement. The multi-tenant one's cross, and also advanced flexes. And like so it has like all of the similar about the body.
Yeah, cool thing to notice. And it's kind of got that like muscle fibers crossing thing going on too. Yeah, it's cool design. So many beautiful, elegant, cool designs in the body. Yeah, so the pecs, of course, are big, strong muscle. And we have so many clients who have that medial rotation of the shoulder, right? So if it's the action to medially rotate the shoulder and a client has a medially rotated shoulder, like slump forward, does that mean the pecs are too short and tight and overused, or long, weak, underused? Beautiful. Short, tight, overused, right? So we're kind of experts at that. And you're going to become even more experts at that when you add myofascial release to your toolkit to really lengthen and stretch. And so you can have a big impact on somebody if they're kind of hunched over. You can have a big impact on helping open them back up. Of course, they might go back to their closing back down activities, but you really give them a different opportunity of motion that they might not have felt in 5, 10, 15, 20. 25, 30, 35, 40, 50 years. All right, cool. So awesome, Major. Let us move on. Yes.